A scar is fibrous tissue that replaces skin that was injured. Scar formation is a normal biological process in wound healing that occurs when skin or organs or tissue surrounding organs is injured. This is a normal part of the healing process. Except for very minor injuries, anytime the body is injured, scar formation will occur. Scar tissue is the same tissue that it replaces, called collagen. Except that in normal tissue, collagen fibers create a random basket weave formation. In scar tissue, those collagen fibers cross-link, forming a more pronounced formation in a single direction. Scar tissue is of poorer quality than normal tissue. For example, it is more sensitive to UV light. Sweat glands and hair follicles do not grow back in scar tissue. Scar tissue is also less elastic. In some scars, the collagen can become overexpressed, forming a thickened scar, sometimes referred to as a keloid. Scars can also appear as sunken. Stretch marks are also forms of scars that occur over a short period of time when the tissue is stretched. This can occur during pregnancy, or during a period of weight gain, or during a growth spurt. Scars can cause pain in and around the scar. They can cause hypersensitivity, such as when clothing rubs up against it. It can also restrict the tissue and nerves surrounding the scar. In some cases can cause nerve pain or neuropathic pain. Physical therapists are trained in various manual techniques to help mobilize the scar. By mobilizing the scar, we can decrease pain coming from the scar itself. We can also relieve tension on tissues and structures surrounding the scar that may be contributing to the pain. Additionally, we teach patients how to mobilize the scar on their own so they can facilitate the rehabilitative process and decrease symptoms coming from the scar. It is important to point out that physical therapists can only mobilize scars substantially externally. We are not able to substantially mobilize scars that are surrounding organs or in deep tissues. Those scars can form due to a surgery or a disease process. It is safe to start to mobilize the scar approximately 6 to 8 weeks after the skin has been injured or a surgery has occurred. With a new scar, it is helpful to start by mobilizing the tissue around the scar, not the scar directly. You can utilize connective tissue manipulation to mobilize the tissue above and below the scar. To address the scar directly, it is best to move the tissue in the direction of the scar, not perpendicular to the scar. It is also important to use some sort of lubrication or massage lotion so you can move through the tissue easily. When tolerated, and as the scar continues to heal, you can move the tissue perpendicular to the scar, which is often referred to as cross-friction massage. To better tolerate scar massage, you can alter the position of the body to slacken the tissues around the scar. For example, with an abdominal scar, you can flex the trunk to slacken the tissue in the abdomen. More advanced scar mobilization techniques include circular mobilizations and tacking one end of the scar while mobilizing the opposite end of the scar. You can also utilize connective tissue manipulation and mobilize the connective tissue along the scar or perpendicular to the scar. Scar mobilization can be performed every day or every other day. A few minutes of scar mobilization each day is sufficient. Improvement in scar mobility and a decrease in discomfort is usually noted within 4 to 6 weeks of regular scar mobilization. Before mobilizing a scar on yourself, it is important to consult with a physical therapist first to receive guidance on how and when to begin scar mobilization. If you have a scar from an injury or a surgery and you think that scar is contributing to your symptoms, be sure to contact your physical therapist to see if scar mobilization may be able to reduce your symptoms. If you would like to schedule an appointment with one of our physical therapists at the Pelvic Health and Rehabilitation Center, just visit our website at pelvicpainrehab.com.